It's 11 a.m. in the village of Nadundo, a farming community located in the Mion district of the northern region. School is on break and children heartily play while parents go about their daily chores. We are here to meet the family of 9-year-old Pona Tagan, who died from kidney disease. It was a painful moment for the family. Her mother, who had been with her throughout her journey, could not hold back her tears.
Nambaka wanamba ko muta jifala umumuna jifala kwala takat bi lo bopaka nakata ko pa.
When the disease attacked Tupana, I was there in the house here, and then they sent her to Nadunda Clinic. That's our town. After the uses of bandages that they want on board, they said they have to send the child to Yendi. The child stayed Yendi for 3 days. After the 4th, that they moved ahead to Tamil Teaching Hospital. From there, they were about 6 days, about the 7th days that we lost the child.
The third of 8 children, Pona Tagan had aspirations of becoming a surgeon. Her grieving family believes she could have lived a healthier, longer life if there were hemodialysis machines and tubes specifically designed for children on dialysis, as well as health insurance for kidney patients.
Adults has their computers from the system up to the end. But the children does not have these computers. Governments will try as much as possible so that from the 9 years children coming down, we also get medicine for that support in any diseases at all, so that it can support us in the last aspect, so that in terms of anything like this one can be able to solve. These are the received from the Tamale only. This is the receipt from Tamale Teaching Hospital only. These are the receipts.
Many children, like Pona, have perished due to the lack of dialysis machines specifically for children, the absence of a health insurance for kidney care, and the high cost of treatment. "15-year-old Feruza Al-Hassan from Gusheu endured 2 years of painful procedures with dialyzing tubes and equipment meant for adults before passing away.
It is painful, very painful. And when they are performing the procedure, I mostly pant for breath. And it's like I'm dying.
Averagely in a year, 25 children die from CKD5, which is end-stage kidney disease, because there is no intervention. There's no chronic hemodialysis program in Ghana for such children, and even talk of transplant in children. Ghana doesn't have those facilities.
This is a huge challenge. Sometimes for the bigger children, the adult physicians in charge of the dialysis units are able to dialyze bigger children. But when they are smaller, then they are left to their fate. And unfortunately, a great majority will die.
Because the amount of blood that is taken is a lot, so what it means that you can see the patient will be on the machine and start having a seizure. The patient can start vomiting, start having tremors and rigors and what have you.
The kidneys filter waste from the blood and regulate water, salts, and minerals in the body. There are 2 types of kidney diseases, acute and chronic. Acute kidney disease is treatable, but if it progresses to chronic, it can lead to end-stage kidney disease with a low survival rate. For surviving children battling this life-threatening disease, their stories did not look very encouraging. According to the mother of 2-year-old Louisa Asante, her son's condition started when he was 3 weeks old. From birth, Louis will cry more than usual when bathed or touched in his navel or lower abdomen. Three-year-old Nakiyat Issa's difficulty in passing stool and urine forced her 32-year-old mother, Sahadat Suleiman, to completely abandon her work to be by her side.
Just when I'm a doctor, no catch him say, when you are a kidney, no, or fair by her say, tell the neighbor do and no more to dialysis.
For Kwabena Boahin, a 3-year-old nursery 2 pupil, his condition hinders his body's ability to effectively remove waste and excess water from his blood. He now depends on a dialysis machine to perform the functions of his kidneys. To manage his condition, he must adhere to strict restrictions on the amount of food and liquids he can consume.
Man parana diachi amelnako hospital. See man paracetamol syrup ni dey setting see man bi. Still ana ne ho junemba. Na me dey call Rebekah hospital. E ho na me wo no, ho na oyare amede ne ko. Ti me ko na me complain kira won say ne no mo ma me aduro na me ko toy. Akwara na oyare edu anadwo a onda. Ten going onda kete so. O she mechi sa na de ebechi. Daytime obedi agro e bibia bet. Even time day, won't mean your shape.
A senior nephrologist at the Confront Teaching Hospital, Dr. Elliot Cranton Tano, says that aside from the prevailing causes of kidney diseases in children, such as birth defects, hereditary diseases, infection, nephrotic syndrome, systemic diseases, trauma, urine blockage or reflux, the rate at which it is increasing in children could be attributed to the increased use of harmful substances in mining, making children the latest addition to a bracket originally perceived for adults. This assertion, to a large extent, is validated by data from the Ghana Health Service that points to some regions at the top of their list of kidney diseases being mining areas.
The worry is that when we keep exposing ourselves to mercury, it has harmful effects, not only on the kidney, on the heart, on the liver, in fact, on your nerves and brain and all. I have a lot of patients coming from the mining areas with kidney disease. The good news they have is that they are rich enough to find themselves on dialysis, or they are working for mining companies that can support them.
Yale first near doing saying penny for Yale, but now no say uncle Anina 8 million.
That is Gabriel Kofi Enchi, the father of 13-year-old Priscilla Enchi. He first noticed rashes around his daughter's eyes and nose in 2016. Initially, they tried over-the-counter medicine, but after several months, they sought professional help and received a proper diagnosis. After 8 years of treatment, they thought Priscilla's condition had improved, but it took a turn for the worse, preventing her from attending classes with her peers in junior high Form 2.
Actually, I started saying the joints. Jafina untimi nantekra. It didn't come to private hospital. I call mienu. I baby. I say ni say be a normal fever ya. The other call back or could you 3 days? No, discharge. The above is not improvement. We only had no call different one back of so the only 1 week. Oh, just not a slam.
Data from the Ghana Health Service also indicate that over the last 10 years, out of 165,959 cases reported in adults across the country, 2,656 were children under 5, raising cause for concern. The majority of these children do not survive.
One of the basic functions of the kidney is to get rid of excess fluid, toxins, and things, end result of processes in the body that needs to come out. So once it can't work, they become big. So some even think, oh, they are putting on weight. Oh, they are doing very well, they are putting on, but it's kidney disease. So sometimes it's hidden for some time. But if you have a child who is born with a problem, a lot of us know that they have chronic kidney disease. But the older children, sometimes it's missed. Some will treat for allergies. Some will treat, they think they're putting on weight, and then later on you find out, no, it's chronic kidney disease. So it can be a bit insidious, if I should use that word. But for acute conditions like malaria, you can actually see, well, this happened yesterday or today, and it's drastic, and you can pick it up.
A lot of adults with renal diseases may be the breadwinners for the family, and they may be the decision makers. So the decisions on where to allocate funds and resources is often taken by adults.
Other factors, such as the lack of dialysis centers, the prioritization of care for adults while children with critical conditions are often neglected, is rife. Again, according to research, about 99% of Ghana's healthcare facilities do not have hemodialysis machines specifically designed for children under 5. And even for children over 5, the few available machines in certain regions are intended for adults, yet they are used for children, leading to the risk of imminent death.
If you look at the distribution of dialysis facilities in the country, it's not the best. There are some we have 16 regions and only 10. We did a review recently, only 10 of the regions have dialysis facilities. Some of them, apart from Greater Accra and then Ashanti region, most of them just have 1 or 2 centers.
Additionally, the appropriate tubes for dialyzing children are not available. So, adult-sized tubes are used instead, making the already painful and strenuous procedure even more difficult and complicated for children. This leaves them looking frail, tired, weak, and struggling to breathe anytime they go for dialysis.
There are 2 major types of dialysis. There's one that typically the adults use. The one that we all know is called hemodialysis, or they're putting on the dialysis machine and the blood is cleansed and goes back and so on and so forth. And there's another one called peritoneal dialysis. So that one, we put a tube or a catheter into the abdomen and we fill with some fluids, and it also does a similar thing that the machine does. But unfortunately, as I say again, we don't have any chronic program for children who have end-stage kidney disease. So if there's a child with end-stage kidney disease currently in our environment, it's a very dire situation and a very sad story.
Peritoneal dialysis is also good. However, we don't have the right fluid to be able to do the peritoneal dialysis. So if you get the right fluid, then if the machines are not yet available, then we can be dialyzing the pediatrics using the right peritoneal dialysis fluid and do dialysis to help to resolve their problems.
While the country battles with the unresolved quagmire of equipment specifically for children with kidney issues, the unavailability of an insurance program to absorb the skyrocketing cost also stare us at the face. So, During the celebration of the 50 years of dialysis in Ghana on Thursday, December 1, 2022, when Dr. Mahamudu Bawumia suggested an insurance cover for children with kidney diseases, it was well received, only for it to remain a mere call up until today.
I think that at the very least, the NHIS at least could cover treatment for children on dialysis.
Insurance is active, but the minimum bibia Rebekah say insurance na cover. Bibia ebe check ye lapse.
Insurance okutan bi nso na bi ebeko bia no do mbe bia no eka aha da kwa minim ye yi ane as insurance no cover senko bo minim.
Cost no dey mean to make huge. Because by 2016 up to now, I don't know the new now insurance can cover. The
cost of dialysis per session in this current economic situation, if we start using our machines, is 700 cedis per session. If you want ideal dialysis or efficient dialysis, you would have to do 3 sessions per week. So 700 times 3, that is 2,100 cedis a week for one person. In a month, this is going to be 8,400 cedis. Even 2,100 cedis, I'm sure, is somebody's salary. So in a month, 8,400 cedis. Stretch this to a year. This is over 100,000 cedis in a year to keep somebody on efficient, quality maintenance dialysis. Definitely, this cannot come from one person's pocket. It's not sustainable.
This is just the dialysis cost. They are not going to buy medications. And then some of them, most of the time, their blood levels are low. So they have to buy an injection, a hormone called erythropoietin, which is usually produced by the kidneys. But because the kidneys are not functioning well, it doesn't produce it enough. So they have to buy. That alone can cost people about 1,000 Ghana cedi a week.
If we were doing hemodialysis, it would be similar cost. Okay, similar, anywhere from 400 to about 600 per session. Aside medications or any other labs, this is just the cost on the machine, times 3 in the week, times in the month, and then the year. It's getting to over 90,000 Ghana minus medication, and that is for hemodialysis. When it comes to the peritoneal dialysis, because we don't have any chronic program going on, it's difficult to cost it.
What government can do is to engulf chronic dialysis, in fact both acute and chronic dialysis, onto the National Health Insurance Program. At least this will take the burden off the families.
We need to, as a country, have a policy to see if we can put dialysis on the National Health Insurance Scheme or find out other funding support by government and other stakeholders to support patients with kidney diseases, and that will really impact kidney care in this country.
Ghana can also improve its efforts by focusing on generating data for children with kidney diseases, a fundamental issue that has become an albatross around our neck. This, according to health professionals, can attract attention for the allocation of resources that will lead to the acquisition of more consumables, hemodialysis machines and tubes specifically designed for children with the disease. This, they say, will impact positively on SDG 3, aimed at good health and well-being.
Children are our future. If we are not merely paying lip service to this, we will need to allocate even more resources to ensure that children are healthy and grow up into healthy adults.
Until that is prioritized, children like Kwabena Boahin, Louisa Sante, Nakiyat Isa and Priscilla Enchi will continue to suffer in silence and learn to manage their condition for life. while the lives of Bonata Gan and Feruza Al-Hassan, who could have lived healthier, longer lives with proper treatment, die early due to the absence of it, hence cannot live their dreams, not to talk of sharing their difficult experience with the world.
I mean, these children, some of them have been coming to clinic, you know them, you know their parents, and they come in with end-stage kidney disease and they die in front of you. Our health system should improve, because I don't believe death is a good end result. This is something that a solution is there. So why should they die?
Urgent action is therefore needed to prioritize the healthcare needs of Ghana's youngest citizens. Rebekah Awuah, The Fourth Estate.